The Fertilab team is proud to present the results of our reproductive technology treatments. When looking at results, we have to focus on numbers. Some clinics can show the results in terms of pregnancy test positive or ongoing pregnancy, but what really matters is the number of live births. Means that you can look at our website and you will find the number of baby born per cycle. For example, in the egg donation program, the cumulative live birth rate per cycle exceeds 85% when compared to the 64% on average published by the Spanish Fertility Society. When analyzing data, it's also very important to know how many embryos we transfer. In Fertilab, we always transfer one blastocyst at a time, and this is the key to minimize risk for the mother and for the fetus, but without losing in terms of results and quality of the treatment. When we analyze the results of IVF with patient-owned eggs, of course, we have to know that it depends on the age of the patient and on the quality of the oocytes. However, even in this case, the cumulative live birth rate per cycle in Fertilab is over 60%, compared to the 32% of ongoing pregnancy of the Fertility Spanish Society published data. And in patients with best prognosis, mean patients below 35 years old, we have a cumulative live birth rate per cycle of 72%. When we apply preimplantation genetic testing to the embryos to screen for chromosomal abnormalities, we are able to transfer normal embryo with high implantation potential. Actually, the live birth rate per single embryo transfer when the embryo is chromosomally normal is 50% per single transfer, compared to the 42% published by the Spanish Fertility Society. In those cases, and in patients with good prognosis and young patients, when we apply PGTA testing the chromosomes, the cumulative live birth rate per cycle is over 90%. In our embryo donation program, the live birth rate per transfer is 30.5% compared to 32% of the National Fertility Society published data. We also offer a guarantee of live births in the program called Baby Ferti that includes 3 embryo transfer cycles from the embryo bank. In this case, patients will achieve almost 90% delivery rate in the program, and in case of failure, we will give a refund to the patient. In Fertilab, we have our own sperm donor bank. It's very important to allow us to match the perfect sperm donor with each patient based on the phenotype, but also based on genetic testing to minimize the risk of transmission or rare genetic disease. In patients with good prognosis, applying for the 3 cycle of insemination with sperm donor, we reach 50% cumulative live birth rate. Those excellent results are the outcome of highly specialized work by our medical team and biology team that will always apply the technique that is needed for each patient. So personalization together with high technology will allow us to give the best results. All of this is also made possible by our team of coordinator and nurses that will give a very human support to the patient even from the distance.